Hi, I'm Daryl, Director of Professional Services here at Home Medical. This is Kim, one of our respiratory therapists. Today, we will be reviewing your CPAP equipment that your doctor has prescribed for you. We'll be reviewing the parts and components to your equipment, as well as going over some cleaning procedures and troubleshooting tips. First, let's talk about what you have received. This is your CPAP unit. Your CPAP unit provides a pressure of air that goes through tubing into your nasal interface to help keep your airway open. There are several functions to your CPAP unit that you should be aware of. First, the button on top is the start-stop button. When your unit is plugged in and you push this button, this will start and stop the pressure that leaves the machine. There are also buttons on the face of your unit that you should be aware of and what their functions are. This will give you access to the menu. Please know that you cannot change the pressure on your CPAP machine. When you access the menu button, you will have up and down arrow keys that will direct you through the menu, and you will be able to change some of the comfort features. On the front of the machine, you have the port where the CPAP tubing goes. Please make sure that if you don't have a humidifier and you put the tubing directly to your CPAP unit, the CPAP tubing is on nice and snug. On the back of your CPAP unit, you have a filter and you have a data card entry port where you will stick in your card to download the data that has been recorded on your machine. Now let's discuss your humidifier. Your doctor has prescribed a humidifier to help you be more comfortable using your CPAP therapy. The humidifier will provide a certain amount of humidity which will help keep your airway moist and will make you more comfortable when using your CPAP machine. There are several components and features to your humidifier. First, there's the humidifier control knob. Secondly, there's the tub in which you would place the distilled water. Please remember that when you fill your tub, you never fill it past the fill line. Place the tub into the humidifier and close the lid until you hear it click. When connecting the humidifier to the CPAP unit, bring the two pieces together and push till you hear the click. To separate the two, first, always make sure that there is no water left in your humidifier chamber. Turn the unit over, push the silver button, and carefully separate the two units. You will receive 6 feet of CPAP tubing with your CPAP setup. Always make sure that when placing the tubing on the humidifier port that it's on nice and snug. Failure to do so will result in a leak. With the other end of the tubing, attach it to the nasal interface. Know that the tubing will fit on most nasal interfaces as they are universally the same. Attach the tubing to the mask and make sure it fits on nice and snug. Kim will now demonstrate some of the cleaning procedures as well as troubleshooting tips to help you become a better CPAP user.
Let's go over some cleaning procedures. Most insurance companies every 3 months will pay for new supplies, meaning your filters, your tubing, your nasal interface, and your humidifier chamber. Back of the machine for your CPAP is where your filter is. Remove the plastic piece, pull out your filter, and you want to check this monthly. Replace as needed. Put it back. Make sure you put your plastic piece on and clip. To clean your humidifier chamber, you want to lift up the humidifier top and remove the chamber. Twice a week, you want to clean it with mild dish detergent and water, warm water. Rinse it through really good. You can also use the cap for the humidifier tub, which has been placed in your CPAP unit. Place your soap and water inside and give it a really good shake. Remove your cap and rinse through. You can also use 3 parts water to 1 part vinegar to disinfect your humidifier chamber. Air dry it and replace it in your humidifier. Again, make sure you hear that click when shutting the humidifier. With your 6-foot tubing, you also want to clean it twice a week with mild dish detergent and warm water. Rinse it through really good. You can also use your 3 parts water to 1 part vinegar to disinfect. You can also hang this over your towel bar to dry. With any nasal interface you are using, take a warm cloth once a night and just wipe it clean. Now some troubleshooting. With your CPAP unit, you get a data card that you are going to take to your physician's office to download information from your CPAP unit. On the back of the machine, there is your slot for where your data card is supposed to be placed. Please do not remove the plastic door on the back of the CPAP unit. What you're going to do is place your data card in the slot, arrow facing in, and read what it says on the top of the CPAP unit. It'll tell you that the card has been inserted and you have to wait. The card needs to be removed. You remove your card and then take it with you to your physician's office. Please do not leave the card in the machine continuously. Again, with your filter and your cap, make sure that it is clicked in. With your humidifier, make sure that after you have cleaned your tub, put it back. You make sure you hear the click on your humidifier. We tell you to start your humidifier setting at 3. You may have to go up or down depending on how you feel in the morning with a dry throat or maybe too much moisture, and that would develop in your tubing. You can go down with your humidifier setting or up as needed. When you have your tubing placed on your humidifier, if you hear a gurgling sound in your tubing at night, that means there's too much water buildup in your tubing. Please drain it out. With your CPAP unit also, you may get a reading on your unit that says an error code with numbers or service required. If this happens, please call At Home Medical. Please do not tilt your CPAP machine when you have water in it. This will cause an error code. Please keep it flat on a surface near your bed.
Thanks, Kim. Please know that the use of your CPAP therapy is crucial to your overall health and well-being. If you have any questions, please don't hesitate to contact At Home Medical at 1-800-287-0643. With any medical questions, please remember to call your physician. And remember, miracles happen at home.